After strong criticism from several quarters, a state commission is reconsidering a move to reduce options on health insurance for public employees. The move affects more than 100,000 state, local, and county employees, with those in retirement also. Among the first to strongly oppose the decision was the Mass Council of the AFL-CIO. We'd like to welcome its legislative director, John Drinkwater. Thank you very much for being with us, John.
Thank you for having me.
First of all, talk about exactly what this decision by the State Insurance Commission would have been if they had decided to stick with it.
Sure. Well, last week, in a surprise vote, the Group Insurance Commission asked their commissioners to take a vote to eliminate 3 health insurance carriers that are currently offered to subscribers in the GIC. That's Harvard Pilgrim, Tufts, and Fallon. That decision would affect over half of the current active employees in the Group Insurance Commission, causing over 200,000 employees to have to find new health insurance plans. And naturally, that caused a groundswell of opposition and concern among our members who were faced with a very sudden decision on which plan to choose, and not knowing if that plan would allow them to keep access to their network and the doctors that they trust.
Well, I would be worried if someone told me that I couldn't continue with my plan, but people with the commission say, well, you could still keep the same doctor, so don't worry. I mean, is it as simple as that?
Well, it wasn't a very strong assurance from the Group Insurance Commission that they could keep their networks and doctors. They said it was a goal to have employees stay with their doctors, and they believe that most of the employees would be able to. But when you're faced with the decision, and if you have to see a specialist, hearing that most will probably be able to keep their doctor, just frankly isn't enough. And there were also members faced with to keep their doctor having to buy a more expensive plan, and yet another cost increase with the rapidly rising cost of healthcare. So it really was not a very satisfactory explanation or assurance from the Group Insurance Commission that that members would be protected.
State officials say that there had been some kind of consultation with either workers or their representatives about what they wanted in health coverage. So was this a totally, secret decision, people blindsided?
It was a total surprise. I have not spoken to anyone who knew that this vote would be taken last week, and that includes the actual commissioners who were asked to take this vote, impacting hundreds of thousands of lives. The commissioners were given the meeting materials the evening before the vote was to take place, and that's when they found out that the proposal would include the elimination of 3 health insurance carriers. And most of our members found out after the vote had taken place the next day. So it was a complete surprise.
Well, the governor, Governor Baker, he appointed people on this commission. He expressed some displeasure around what happened. And of course, some of the other developments that went on, Maura Healey, the Attorney General, some of the people in the legislature, talk about how that's coming into the mix now.
Well, sure. I mean, almost instantaneously, there was a huge backlash, starting with the subscribers to the plans, many of whom were our members, and we came to find out that even members of the legislature, including legislative leadership, were caught by surprise, and I think justifiably, many people were really surprised by this and agreed that the process was sorely lacking. I will note that when the vote took place, it was only the 5 commissioners on the GIC who are representing employees and come from organized labor that objected to this and that voted against the proposal. So, I will say that they had the foresight to kind of see what would happen and the groundswell of opposition that would happen from the members. But sadly, it was only the commissioners representing labor that knew right at that time that this was a bad decision.
This is BNN News. We're talking with John Drinkwater from the Mass AFL-CIO. John, a lot of the fiscal watchdogs out there are saying, maybe we ought to expand the reach of the GIC, have more public employees under this as a way to be more cost efficient. But among the employees where this has happened already, what's the experience been like?
Well, we haven't seen the cost savings at all. In fact, just in the last 3 years, the Group Insurance Commission has shifted over $300 million from the state onto employees through increased copays and deductibles. And that has been the response to the rising cost of healthcare, but it's completely unsustainable. $300 million onto workers is a very significant impact on working people and retirees on fixed income. So, the cost savings certainly hasn't materialized, and what we're hearing from our members who, from at the local level, who have come into the GIC is a strong dissatisfaction, with the insurance offered by the Group Insurance Commission and the increasing out-of-pocket costs that they are faced with.
By the way, when you reduce the number of plans that employees can choose from, it seems that you're also shrinking competition. That doesn't seem like necessarily the right way to be cost efficient in the long run. Do we know if that works?
Unfortunately, we don't know. And the amount of data and background that was released along with this decision was essentially none. So we really don't know if the GIC has looked at the long-term impact of consolidating health insurers, and if they have looked at it, what the outcome would be. But I think it's certainly important, and this is really what should have happened had they sought public input before rushing a vote on this. These are all the things that should be asked. I know that the legislature is convening an oversight hearing on the GIC next week, where they're hoping to gain more information on the background and what went into the decision and how the various proposals from the vendors were scored. But that's all the sort of thing that should have happened before a vote took place, and long before a vote took place.
Well, if the commission does vote to give this some more time, what do you want to see done with that time to get a better result?
Well, certainly we're happy with the fact that they will be reversing the decision. The GIC is recommending a reconsideration of its vote next week, and a recommendation that they'll stick with the current plans that are offered. But for us, this is certainly a big problem that's come about in the last week, but it's really a symptom, I think, of a bigger problem. We've been saying for a long time that the GIC's process is not transparent, that they don't seek enough public input from members and from unions before they make these decisions, and there's not enough representation for employees on the commission. So we're going to continue to push for reforms at the GIC, including more labor representatives on the commission who can represent the interests of employees and retirees. And we're also pushing legislation that would limit out-of-pocket costs. It's been a huge problem when the GIC can essentially just unilaterally decide to change copays and deductibles and shift costs onto workers. They have to be much more creative in how they achieve cost savings rather than just continually shift the burden onto workers.
Thank you very much for being with us.
Thank you.
John Drinkwater from the Mass AFL-CIO.